Escherichia coli in food by Kristen Blanton, Stephanie Denning, and Garrett Jackson.
After awakening with a low-grade fever, vomiting, and bloody diarrhea, a girl named Gigi realizes there's something incredibly wrong. Gigi's mom becomes concerned and brings her daughter to the hospital in search for treatment. Little does Gigi know that her symptoms are caused by E. coli.
Escherichia coli, or E. coli for short, is a common rod-shaped bacterium ranging in size from 1 to 5 micrometers in length. It can be found in the gastrointestinal tract of most mammals and actually colonizes in humans within a few hours after birth.
E. coli plays an important role in maintaining intestinal physiology and health. However, E. coli strain O157H7 is pathogenic to humans. Identified by the distinct O and H serogroups, this strain produces a powerful toxin often referred to as shigatoxin, STEC, or verotoxin, VTEC, which can cause severe illness. Characteristics of this E. coli strain include its acid tolerance, antibiotic resistance, and thermal sensitivity. E. coli thrive in warm, wet, dark places that are rich in nutrients, such as human and animal intestinal tracts. Once excreted, the bacteria cannot survive the harsh conditions of the outside world. Meet the coli family. They belong to the E. coli O157H7 strain. This particular family decided that it's time to leave their home in Roscoe the cow's intestines and take a vacation to a human gut. Although it's hard to say how this strain of bacteria got to the cow's intestines, they tend to live in more stressful cows that are round up on farms and headed off to slaughterhouses in small trucks.
It's time for Roscoe to defecate, and this is the family's ride out of here. So their bags are packed and they are ready to explore. Because cows are in close quarters, they often urinate and defecate on one another, causing the coli family to be spread all over multiple cows' hides by the time the cows have reached the slaughterhouse. In the slaughterhouse, the cows are hung on a conveyor belt while their hides are removed. Although the muscle meat of the cow that is used for food is sterile, the jerky movement of the conveyor belt allows the coli family to touch this meat for the briefest of seconds, causing contamination. This is how the coli family got on the meat. But other vacationing E. coli families can also get transported to the meat when the intestines of the cow are accidentally sliced open during the cutting process. This causes the E. coli to spread over the meat very quickly. Let's take a closer look at the slaughterhouse rules. In 1907, the laws only allowed the meat inspectors the ability to look, smell, and touch the meat. No microbial testing was allowed until a revision in the law in 1996. The HACCP, which stands for Hazard Analysis and Critical Control Points, was introduced in order for the meat inspectors to assess situations where the meat could have potentially been contaminated. These new inspections required microbial testing. However, there are always cases where the contamination goes unnoticed, so the meat inspectors in this slaughterhouse missed the E. coli family's ride over to the muscle meat of the cow. Now, all of the cow's meat is ground up to be formed into hamburger meat. Since all of the cows are ground up together, there could be over 100 different cows in an individual hamburger patty. This makes it easy for that little bit of meat containing the coli family to end up contaminating large amounts of meat that end up being shipped to a bunch of different locations.
Gigi wants to have a hamburger for dinner, so she gets her meat out of the refrigerator and it happens to contain the coli family. She starts up the grill and puts on the meat. Gigi is very impatient because she is so hungry, so she takes the meat off before it's done cooking. Gigi likes her hamburger a little pink anyways. Since the meat wasn't cooked long enough, the coli family still survives. She eats the meat and the coli family are excited to be on their final stretch of their journey to the new vacation home, Gigi's intestines.
Let's take a minute to look at the proper way to cook meat to prevent the spread of E. coli that can lead to sickness. Washing hands after touching the meat is one very easy way of preventing bacteria from contaminating everything that is touched. Also, cooking the meat at 160 degrees Fahrenheit is needed to make sure the E. coli is killed. Checking the meat for any red or pink areas is a good idea to ensure the meat is fully cooked. Proper cleanup techniques can also ensure that the bacteria aren't spread. This includes spraying the counters or any area that the meat might have touched. Since Gigi didn't follow these steps, she ends up getting hemorrhagic colitis. which is the acute disease caused by E. coli O157H7. Gigi experiences a low-grade fever, vomiting, severe abdominal cramping, and diarrhea, which turns bloody within a few days. The sight of blood is alarming. She decides to go to the hospital. The doctor diagnoses Gigi, and luckily she has a relatively mild case.
In some cases, the disease can progress, often in young children or the elderly, to hemolytic uremic syndrome, which is characterized by hemolytic anemia and renal failure. About 15% of cases result in development of HUS and can lead to permanent loss of kidney function. The elderly can also acquire thrombotic thrombocytopenic purpura, which involves HUS, fever, and neurological symptoms, and accounts for a mortality rate of 50%. In 1975, E. coli was first identified as a human pathogen when a California patient complained of bloody diarrhea. In 1982, the bacterium was for the first time linked with a foodborne outbreak. Now we know that disease outbreaks are most closely associated with ingestion of E. coli contaminated food or water. This may include undercooked ground beef, water sources, unpasteurized apple cider or milk, fresh vegetables or fruits, sprouts, mayonnaise, and salami.
Person-to-person transmission is possible, and there's a potential for airborne transmissions as well. However, cattle are the primary reservoir, and STEC bacteria usually do not cause illness in animals, so it is hard to visually detect and prevent. E. coli can be carried by geese, sheep, horses, dogs, seagull, goats, and deer, but can also be found in environmental sources such as water and soil. Environmental sources allow the bacteria to transfer to fruits and vegetables. Young and stressed animals carry E. coli more frequently, and in the process of transfer, as little as 10 microorganisms needed to present to trigger infection.
E. coli accounts for 73,500 illnesses, 2,200 hospitalizations, and 60 deaths in the U.S. 85% of these cases are caused by foodborne transmission. Large outbreaks from food contamination have been documented in Canada, Japan, and the UK. Nearly 19% of retail uncooked beef may be contaminated with the bacteria, and 4% would include the verotoxin strain BTEC 0157H7. It has been suggested that there are significantly more sporadic infections than outbreaks caused by E. coli.
There is no proven or effective treatment for E. coli strain 0157H7. Antibiotics may increase risk of problems, and anti-diarrheal medicines should also be avoided. It is best to wait out the infection and to rest and drink plenty of fluids. If bloody diarrhea is noticed, then it is best to call a physician because this means that the symptoms may get worse and lead to HC or HUS.
There are several ways to prevent infections. Cook all meat thoroughly.
Wash fruits and vegetables before cooking or eating raw.
Drink only pasteurized milk, juice, and cider.
Avoid sprouts.
Don't drink water from open streams or other water sources. This includes swallowing lake or pool water.
Wash your hands carefully after handling raw meat or handling animals.